So overnight we got the news, it was the front page of the Daily Mail, that 50,000 people had not been diagnosed with dementia since the start of lockdown. And that of itself would be a worrying story, but frankly, it isn't much more than the tip of the iceberg, because we've actually got nearly 300,000 fewer admissions to hospital for cancer since the start of lockdown than otherwise we would have done. Goodness knows on top of that how many other misdiagnoses there are for heart disease, diabetes and many other problems. Add to that the fact that the National Health Service is now 5 million operations behind, and waiting lists are going to be the longest they have ever been in the history of the NHS. And even getting a straightforward GP appointment, well, you can do it via Zoom, but actually, if you've got a young child that perhaps can't speak for itself, it's a very, very worrying time. And I think the truth of all of this is we have a really big, looming health crisis. By the way, I'm not blaming anybody that works as a nurse, as a doctor, or works within the NHS. That is not what I'm talking about today. What I'm talking about today is being honest and saying we are facing a massive health crisis. We are so far behind with operations and diagnoses that we simply will never, ever catch up. And yet, the response from government seems to be to say that everything is absolutely fine. We have no problems at all. Let's clap for carers. Let's clap for the NHS. Let's pretend everything is absolutely wonderful. Well, it isn't. And I'm seeing a new trend. I'm seeing it in my family. I'm seeing it amongst friends. And let's face it, I mean, we talk about health, I think, at home more than any other subject, perhaps with the exception of money. I mean, just today, my mother has been in for a knee replacement. She went privately and paid for it. I don't think she's ever done that in the whole of her life. She's done it because the waiting list is simply too long. And I've got other friends who've sent their parents and others away to get private diagnoses or operations. And I fear that what the looming health crisis will do is to divide this country yet again between the haves and the have-nots. Those that can afford it increasingly will pay to go and get private medicine, and those that can't afford it will be left to the long waiting lists of the NHS. It's something I think government seriously needs to address, to do it honestly and to do it very, very quickly. At the moment, I see no sign of that whatsoever.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.